Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hey listeners, it's Lindsay Smith Rogers. Today, is there a fertility crisis in the U.S. and around the globe? Dr. Linnea Zimmerman is an associate professor in the Department of Population, Family, and Reproductive Health at the Johns Hopkins Bloomberg School of Public Health. She joins Dr. Josh Sharfstein to talk about the global picture as well as the family-level view of fertility in 2025. Let's listen.
Dr. Linnea Zimmerman, thank you so much for coming to Public Health on Call to talk with me about fertility rates.
I'm happy to be here.
Before we jump in, could you explain a little bit about your background and your academic interest?
Absolutely. So from an academic perspective, I'm an associate professor in the Department of Population, Family, and Reproductive Health. I study fertility, and I have had historically a particular interest in studying contraceptive use and access to contraception.
So I've been reading a lot about fertility rates in the news. There are a lot of opinions out there, but I want to start with some basic facts, like what is a fertility rate?
That is a great question. So there's really, when we think about fertility, there's kind of two different ways that we think about fertility and fertility rates. So there's a period measure. And what that means is that's what's happening right now. We're looking at the number of births that are happening to women, usually age 15 to 49, who are alive right now. And we're saying, like, this is the average rate of what is happening in 2025. And that's what we call the total fertility rate. And that's the number that you see kind of floating around right now. That in the US, it's around 1.6 average children per woman. But there's also something called the cohort fertility rate. And that is really the average number of children that a woman has at the end of her childbearing years. So if we think about that 15 to 49, what we're really thinking about is what is the average number of children that a woman has by the time she is finished childbearing. So there's a little bit of a difference there.
So talk to me about that difference. Is it that 1.6 number might be a little bit misleading if you only knew that number compared to the cohort number?
Absolutely. So what could be happening right now, the US has done a really good job at dropping adolescent fertility in the last few years. And so we see a lot fewer teenagers having children. And I think most of us think that's a pretty good thing. But that means that the total fertility rate has kind of gone down. It's suppressed.
Right.
But if those young women go on to have children just at a later age, they might still just be just as likely to have two children.
Got it. So what you're saying is if the cohort fertility rate is about the same, but within that cohort, people are having births later, then that moment in time fertility rate is going to look like it's dropping for a while.
That's exactly right.
That is so interesting.
So we're pretty sure that that is happening. We know that the period fertility is dropping. What we're less sure about is that what we call fertility foregone, where those people may not go on to have those two children? Or is it fertility delayed, where they will go on and have those two children?
Well, let's take a step back and look at the world. What's happening with fertility across the globe?
So fertility is falling across the globe, but what's really important to think about is that there's a lot of variation. So there are some countries in the world where the average number of children that a woman has is somewhere around 6 or 7. So we're thinking about places like Niger or Chad, largely in sub-Saharan Africa, but fertility is still really, really high. And then there's places like South Korea and Taiwan where women are having less than one child on average. So South Korea just recorded the lowest, again, total fertility, period measure, but the lowest fertility of any country at 0.7 children per woman. So there's huge variation. But on the average, on the global average, we're still at about 2.2 to 2.3 children being born per woman. So we're still above replacement.
Yeah, tell me about replacement. What is that concept again?
Replacement level fertility is this idea of the average number of children that a woman needs to have, again, by the end of childbearing, so by the time she's 49, of 2.1 children per woman. And it's basically what a population needs to replace itself. A woman is having a child for herself and her partner.
Got it. Putting this together, the United States, the current fertility is dropping, but the cohort fertility is still a question mark. And the world above replacement, do we have a fertility crisis right now?
That is the question. That is the $1 million question. I think that in some places, and I'm thinking again, these ultra low fertility settings like in East Asia, there is definitely an important question of what is going to happen in terms of thinking about economic support for the elderly, in terms of thinking about how to redesign your systems to make sure that your society is able to weather this transition. But on a global scale, I would say there are still more children being born than we need to replace ourselves. And the UN is expecting that by the year 2100, there will be 10 billion people on this planet. And there's about 8 billion now. So we're talking in the next 75 years that this planet needs to accommodate 75 billion people. So I think the question of whether it's a fertility crisis depends on what you're thinking about. Are you thinking about local? Are you thinking about global? And is it too high or is it too low?
What is the role of migration? If there are some parts of the world with high fertility and some parts of the world with low fertility, then one question might be maybe migration could help even things out. What do you think?
I think that is definitely something that has a lot of potential. So as you said, there are areas in the world where there are the population is extremely large, and there's a number of youth, and there's people that are educated, and they are in need of opportunities that maybe in low fertility and high income countries, those opportunities are more available because there aren't as many young people and there aren't as many people having children. And so opening up for migration is absolutely one way that some of these countries can think about how they can relieve the dependency burden in their country. And what I mean by dependency burden is if you have one working age adult, how many people over 65 are they supporting? And how many people under age 15 are they supporting? So opening up for migration and allowing working age adults to come in absolutely will help alleviate some of those financial and economic burden.
I wonder whether there's another way to look at this question of fertility instead of the big questions of how many people fit on the planet, the smaller question, but critical question of how many children people actually want.
It's a great question. And the UN just put out a report this year saying that the real crisis in fertility is a crisis of reproductive agency. And it's the idea that we hope as a public health community that we would be able to help people have the number of children that they want. And so for some people are having too many children, more children than they want. And we think of that concept usually as the idea of unintended pregnancy. So in the US, there's about 30% of people experience an unintended pregnancy and maybe have more children than they would otherwise have desired. And yet at the other side, if you flip that coin, there's also an increasing number of people who are having fewer children than they desire. And that may be what's driving these artificially low period fertility rates is that people are delaying. They don't think they can have as many children as they might want. And so then we start to see that there's increasing numbers of people that aren't having as many children as they want. And what that means is people are just not able to achieve their desires.
And why do you think there are so many people who aren't able to have the number of children that they want to have?
There are a lot of reasons for that. We think the economy, job insecurity, housing insecurity, the cost of childcare, these are all rapidly increasing, and people are feeling uncertain about their future and about their ability to support a child. And I think what we might see for that is maybe we see people who have one child because it is something that's so intrinsic. It's something that's so important to so many people, but they might not go on to have that second child. Or maybe they want a third and they say they absolutely can't afford it. And so that's where we might start to see a lot of impact is people are really uncertain of if they can afford a child. I think something else that's especially important to the youth and young people, and it should be important to all of us, but I think is really resonating with young people, is concerns about the environment and climate change and that global perspective of how many people can we fit on this planet when our environment is rapidly changing.
Let me ask you about gender dynamics. Does that affect the number of babies that are born if the work at home is not shared in a way that is conducive to having a larger family?
I think absolutely. Gender dynamics is another one of those big questions, and it fits into a little bit of the economy question as well. So again, on a global scale, I think there's still a lot of work to go, but we have done a much better job of promoting the ability of women to be educated, to work in the labor force. There's so many more opportunities for women than there used to be in many parts of the world. And yet at the same time, we haven't done as much of a job of really allowing men to have a more expansive role in society in terms of caregiving, in terms of being in the home. And so what that means is that oftentimes women are both responsible for bringing in an income. We've got those economic pressures. So they're being educated, they're delaying births, they're getting jobs, they're bringing in an income. And then they're going home and having to take care of the child. And that's a huge burden on women. And a lot of women are saying, I don't want to do both of those things.
Right. Maybe they're not just taking care of the child, they're also taking care of the partner.
And they're taking care of maybe their parents or their in-laws.
So we're talking about both the big macro level question of fertility, how many people the earth can hold, whether we're at replacement or beyond replacement, or the variation across countries, and this micro question of whether people can have the number of kids that they want. Is there any way for those two kinds of conversations to come together? Do we think that if people had the opportunity to have the number of kids that they want, that might balance things out better and maybe get us to a better place in the macro level?
I think that that's really the key. So there have been multiple sort of opinion polls that have been done across many of these settings where there's low fertility. And people on average want about 2 children, slightly more than 2 children. They really want something that's like slightly above replacement. So it's not that people on average don't want children. It's that something is keeping them from having the number of children that they want. And if we could address in an equitable way what those barriers are, I think we would, if you are considering fertility crisis as low fertility, we would be addressing that by helping people have the number of children they want and getting people towards that replacement level. And then on the other side of the coin, again, in these settings where there is very high fertility, there's evidence that people, again, are having more children than they want. So let's continue to invest in helping people to have the number of children they want through equitable distribution of resources, reducing the cost of living, making sure that people have access to good, high quality care. And those things should even out. If people are able to achieve what they want, we would probably be right around at replacement fertility.
So interesting. If we are able to do right by families, then maybe the families will be able to essentially do right by the planet.
That would be the hope.
Dr. Zimmerman, this has been such an interesting conversation. Thank you so much for joining me today on Public Health on Call.
Oh, I'm so glad that I could. Thank you for the opportunity.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Rachel Walsh. Audio production by Michael Bonfils, Matthew Martin, and Philip Porter, with support from J.B. Arbogast, Spencer Greer, and Chip Hickey. Distribution and social media by Rachel Walsh, with support from Nick Moran and Brianna Iacovelli. Follow us on Instagram and Blue Sky at Public Health Pod for more public health takes and special content. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.